When I started practice, I trained at the Ferguson Clinic, and we did a so-called Ferguson hemorrhoidectomy. Basically what we did was we took the hemorrhoid, cut it off with a pair of scissors, just let the pedicle bleed, put stitches in the pedicle. That just was never very satisfying. It always was kind of bloody fields. You were kind of blindly putting sutures in. It was just kind of messy. And so I got introduced to one of the competitors' devices probably 15 years or so ago. I liked it. It was a vibrating harmonic device that I used, and it did a nice job of keeping most of the field pretty dry. I could see the pedicle pretty well. I could see exactly what I was sewing. I was always a little dissatisfied because it was usually a little bit oozy. You usually got a little bit of oozing. The pedicle was never completely dry. I always felt I had to put a stitch in the pedicle. And so I got introduced 6 months or so ago to the THUNDERBEAT, and I liked it because I had the sealing ability besides the vibration, the harmonic part of it. And I like that, and I've tried it, and it seems, I like the hemostasis. It seems a little quicker than the competitor's device as well. And plus, when I pre-treat the pedicle and seal it first, it's always almost always dry. If I have a really big one, I still kind of have the old luxury of putting a stitch in if I want. But for the most part, I've gotten away with putting any sutures in. I do basically a sutureless hemorrhoidectomy at this point, which saves me a little bit of time. And it makes for a nice dry field, and patients seem to do pretty well with it.